Hi and welcome to this Wound Hygiene Bitesize podcast. My name's Shelley Hawkins, Strategic Customer Engagement Manager at Convatec. During this podcast Bitesize series, we're going to be introducing you to wound hygiene, a simple 4-step protocol of care that anybody can do. So for this first episode, I'm joined by Rachel Torkington-Stokes, Director of Clinical Solutions at Convatec. Rachel, can you start by telling us how the wound hygiene story began?
With pleasure, Shelley. So back in 2019, there was a problem statement was emerging that global wound care was in crisis. And this is largely attributed to we've got an ageing, growing population. And with that population comes increasing complexities of our wound care caseloads and comorbidities. Along with that comes increasing costs. So those direct costs to the healthcare expenditure and services, and most importantly to our patients and their quality of life. And the other problem is that we're seeing out there in wound care is an increasing resistance to antimicrobials. So quite a challenging situation.
Yeah, it's a really complex problem to try and address.
Absolutely. So how we looked at it was we invited a group of global experts to London, and those experts were from scientific and healthcare backgrounds, both nurses, medics, podiatrists. And we started to explore the problems and look for solutions. And it was a really interesting discussion because out there now, when we look at the reason why global wound care may be in crisis, we obviously look at the patient as a whole. But as clinicians, we also wanted to look at the local wound environment and local barriers to healing. And I think what we know today, a lot around exudate and infection, but there is the biofilm problem, which is an emerging problem. And the panel felt that this was potentially a missing piece of the puzzle.
Yeah, and we know now, don't we, that there's biofilm present in almost 80% of these hard-to-heal wounds.
Absolutely. And I think, it's really key because we know that biofilm can be difficult to detect and assess. But so biofilm is a real problem we need to look at. But interestingly, along with biofilm, there was things around the terminology because we look at chronic wounds and hard to heal wounds that are there for a long time. And we really think about, is wound management very passive? And should we be more proactive in how we actually manage these wounds and think about our language? So this word chronic, which can be forever, long-standing, is that the right label for wound care? So terminology was another thing we looked at, as well as the local barriers to wound healing. And putting those together, really, there was a focus on education and actually how do we therefore drive change? Because this is all about being an agent of change. And we can maybe drive change by back to basics and protocol. And that is all how wound hygiene came about.
Yeah, so can you tell us about that protocol of care?
Yeah, so the wound hygiene protocol of care is comprised of 4 steps: cleanse, debride, refashion and dress. And it is about going back to basics. But the beauty of wound hygiene is it's really a club for everybody managing wounds. And it's about whatever care setting, whatever healthcare professional you are and skill mix, you can apply some level of wound hygiene to those hard to heal wounds.
That's great, a protocol that everybody can do. It sounds fantastic, but have we managed to generate any evidence to show that it's effective?
Yeah, and that's a great question, because at the end of the day, when these protocols are developed, understandably, to empower all clinicians to follow them, you want to prove they work. So the panel was so confident about this protocol that they made a very bold statement. So there was the first international consensus document published in 2020. And within that document, they made this statement around following the wound hygiene protocol will improve healing rates, will have a benefit to those patients on the impact of life, and be a costly and efficient way of managing wounds. So we wanted to prove this. Yeah. And, what we did was we started the Wound Hygiene Challenge.
Blimey, that's a bold statement to make. So how did the Wound Hygiene Challenge, what was the outcome of that?
Yeah, so the Wound Hygiene Challenge is a really interesting project for us because it wasn't just about gathering data, it was about educating first. So what we did at Convatec, we worked with healthcare professionals and we actually developed a healthcare program around education because it's important people start to understand the why barriers to healing, why it's a hard to heal wound, and most importantly, what is biofilm as well. And after we developed the education session, we then asked those healthcare professionals to go back into their care setting and identify wounds that they felt would be appropriate for the wound hygiene protocol. So I think we started our data capture and analysis back in 2021, around December time. And that went right through to December 2022. So when we looked at the results, there were 693 wounds and from across 5 European countries, including here in the UK. And it was really interesting because this evidence is real world evidence. We looked at the wound care settings, which, like here in the UK, we've got community clinics, we've got outpatient clinics where a lot of these wounds are being managed. And we looked at the disciplines who were managing them, which again was truly representative of district nurses, potentially advanced nurses like tissue viability nurses, some medics as well, podiatrists. There was a whole broad range of wound care professionals. And when we actually looked at the wound types, again, there was a variety of wound types, with the largest number being venous leg ulcers.
As you would expect.
Absolutely. Yeah. And we've seen that with other work published. So venous leg ulcers were in there along with diabetic foot ulcers, dehisced surgical wounds, all those historically labelled chronic wounds that we now term hard to heal. So this data was so rich. But most importantly, when we looked at the results, we were blown away. So we had 693 wounds. And our primary endpoint of the Wound Hygiene Challenge was looking at percentage reduction in wound volume. When we analysed the data, 80% reduction in wound volume as our primary endpoint.
That's absolutely fantastic, incredible results.
Statistically significant. Yeah. So we were so thrilled. And then our secondary endpoints, which were suspected biofilm by visual assessment, and we guided that with a consensus document which gives indicators that the clinician could look for. Also local infection and biofilm, all of those secondary endpoints also got statistical significance.
Amazing. So what's happening with wound hygiene now? What's happened since the Wound Hygiene Challenge?
Well, there's lots happening. And what I would say in a piece of the Wound Hygiene Challenge was we asked the clinicians who follow the wound hygiene protocol, would you continue? And amazingly, 99% said, yes, they will continue, which is just fantastic because think of the impact of all those patients who are getting this protocol. And they're going to get better wound care outcomes, which is absolutely amazing. And, you know, what I will also say is at this point is a huge thank you to all those healthcare professionals who've taken part in wound hygiene and adopt wound hygiene today, and those listening who might go and want to implement wound hygiene. But what we're doing is that data has been published in the Journal of Wound Care. And also what I would say is I'm delighted to share that earlier this year, the Journal of Wound Care Wound Hygiene Protocol was for all the global implementation we have in 38 countries around the world. We were the winner in the category of chronic wound healing and innovation, which is just delightful and testament to how successful the wound hygiene protocol has been.
Yeah, that's absolutely amazing. And why would you not adopt the wound hygiene protocol of care with results like that? I think it's absolutely fantastic. So I hope we've got everybody really excited about wound hygiene for this podcast. Thank you very much, Rachel, for joining us. And in the next episode, we're going to be joined by Dr. Kate Meredith, and she's going to tell us all about biofilm and why it's such a challenge for us. So we'll see you on the next episode.
Thank you, Shelley. It's been a pleasure.